Assalamu alaikum. Today we're going to talk about a subject where you will be needing it as a prosthodontist in your work, in your clinic, in your administrative positions, whatever they are, or even in your research, because you're going to do research. So it's called the medical terminology, or the scientific terms that you're going to use for searching for many stuff. The idea of any terminology is that we want to speak a common language. For example, if I'm talking about dental implants, immediately you have an image of dental implants in your mind, okay? So that means that the terminology for me and you is clear. It's going both ways. You understand what I'm saying, and I'm understanding what you are saying. Now, this becomes a bit more tricky when we're talking to patients, because patients do not know exactly what we're talking about. The patients usually don't exactly know. For example, if you tell them implants or bridges, they could not even differentiate between those two. Okay. So the terminology that we want to speak should be scientific. And where is more scientific than PubMed for our specialty, because we're a health-related specialty. We'll look for them as usually in PubMed. You might write here implants, and what you'll get all types of body implants, for example. We don't want those implants. We need specific implants. We're talking about dental implants. So the more specific your terminology, the more easy for you to find subjects related to that the thing that you want to search for. But if we go to advanced, leave PubMed, okay, go to advanced, and you will find here the MESH terminology, which is the subject headings, medical subject headings. So this is the search engine for the headings, okay? You find them here. So whatever I'm going to put here, it will tell me what are the terminologies related to that subject. Okay, now because we are dental, so I'm going to write dental. Okay, I'm going to write dental here. So we're talking about dental terminology. Okay, what did we get? We got around 266 related to dentistry. These are terminologies related to dentistry. So if you go through them, and I would advise you to do so, you will find that you are enlarging the terminology and even your insights in the dental field. Why? Because terminology actually means that the more you read about, you see terminologies here, for example, the more you are able to explain what you want to say, and you have this large amount of terminology or terms to describe, okay, what you want to say. Okay, I've done some previous searches, and this is my previous searches. So dental, I found here 266. Dental as a term between parentheses, I had 599. The good thing about this terminology on PubMed, when they are talking about the medical subject headings, they have some brief explanation of what is there, okay? So for example, photoinitiators dental, it's a chemical compound. So photoinitiators doesn't have to do anything with light curing, for example, in terms of the devices themselves. No, these are chemicals inside material that are affected by the light, for example. Okay, so photoinitiators dental. That means there are some photoinitiators that are not dental. This is another advantage of this terminology case, where it gives you the definition of the stuff related to dentistry. So many times we will have some subjects that are related not to dental, okay? They are present in other types, parts of the body. And because PubMed is health related, we're talking about usually the human health, okay? So this is specific. So it's always talking about something related to dental definition. So you have all of these things appearing. Here, this search produced 266. For oral, we had 113 terms. Dental, this is 599. Let me just check what's this. Okay, it's also the same. It seems to be the same, but it seems that it put the dental in the term itself. Okay, so it's dental prophylaxis. The one previously was not, the dental was not part of it. It's just defining the terms in terms of dental. So this is more wide, and these are the dental terminologies. I would advise you to print this out, the total number of the terminologies. It will be like a dictionary for you. Have those present if you want to work with academic work, you're going to do research. So always check these. For my students, if they're then going to do research, I'm going to let them look through these glossaries to check what are the terms that we're going to use in our research. Okay? If in terms of oral, if I'm talking about oral, these are the terminologies related to oral, and they are more broad in terms of they are looking at the soft tissue mainly, the soft tissue, the tongue. So it's not only dental tissue. Okay, dental is related to teeth usually, but oral it's related to the oral cavity altogether. So you get more oral medicine and oral surgical terminologies if you're going to use this. Now, this is for all dentistry, all oral. What about prosthodontics? We have this, the glossary of prosthodontic terminology, and this is what I'm asking you always to put down in your presentations as a final slide. Always use the terminology from the glossary of prosthodontic terms, okay? So this is specific for our specialty. So it's no longer general, okay, and open. We're going to talk about our specialty as prosthodontists. So these are the terminologies, and how are they are coded. Okay, first of all, these terminologies are not produced by one person. These are actually like a consortium where everybody, all of these join together and try to find the definition. They also have a specific methodology. It's attractive to, it's very interesting to read these. And I loved while I was reading them. Then they would go into the terminology themselves. Just here to tell you that this has gone through 8 previous editions. Now there are 9. They also give you the pronunciation key codes for the glossary. So you can also pronounce the word through the codes present here, okay? Also, you will find that they are also talking, if it's plural, it works like a regular dictionary. If you have been through the experience going through the dictionaries before, you will find that you will have all of these telling you in what form of word is this word that you're presented with, or the term. Then you go to the ABCs of it, and they are alphabetically ordered. They also sometimes give you the year where this terminology became apparent. Okay, sometimes they give you a paper or a reference where this terminology was used. For example, some terminologies are taken from a paper, and from that paper on, from that point on or forward, it became part of the prosthodontic terminology. So these are the way. I love where it also gives you adjustment, and then it gives you, for example, complementary words or different words related to this. Sometimes they are synonyms. They are the same word, but different synonyms, okay? For example, let me go down here, for example. These are components, for example. This is alloy, and these are other terminologies related to the word alloy. Oh, here, synonyms. So altered cast has another name. It's called corrected cast or modified cast. These are called synonyms. So it's interesting to go through them in your presentations. Please make this a standard for your procedure. Always add key terminology related to your presentation in the last part. Why do we need them? Simply to know what are the subjects covered in your presentation. Okay, what other people, let's say, what other sites provide us with these terminologies? If we go, for example, the ADA, the American Dental Association, they have what we call administrative and dental clinic terms. Dental clinic terms are the terms used in the clinic in terms of treatment. So we go down here, they are alphabetically ordered. You have them, so if I'm talking about a chronic radicular abutment crown, so these are clinical terminologies, and these are the things that you should put in your clinical entries when you're doing with the work with your patient. So you have to use the correct terminology when you put your entries on the treatment you provided for your patient. Other than that, they also have something called dental administrative terms, because, you know, they deal with the legal issues about running the clinics, the polyclinics, multiple clinics, whatever. So they work with legal terminology. So administrative terminologies means the legal terminology they use when they're dealing with doctors. So what do they mean? Administrative cost? What do you mean administrator? Who's the administrator? Allowable charge? So all of these are terms related to the legal issues related to clinics and as well insurance companies. Okay, so these are also the terminology used with insurance companies. Other than the American Dental Association, I found this example, a beautiful sample of the Irish Dental glossary. They also have this glossary. But what was interesting here, that if you go through the terminology, you will find that they have also images showing what do they mean, okay? Some of the images are a bit old or they're not color corrected, but these give you an insight on what the term that is used, okay? The final one related to our specialty is the ITI Dental Implant Glossary, the glossary of the oral and maxillofacial implants. If you press them, they provide you with this glossary. They say it's more than 2,000 implant-related terms. It's very important for you also as a prosthodontist to know them if you're working with implants. Okay, if you want to go through to see it, okay, you need to be a member, but for me, I'm not a member at the moment. So if you could find doctors that have this document, I'll be very thankful if you can provide it to me. If you have somebody with an access to the ITI, we have multiple staff in our clinics that are affiliated with this, or not affiliated actually. They have some membership in this organization. Okay. Also, you have WordPress provides also. This is a PDF. Once more, glossary of implants. This is also present. It tells you, for example, who published it. So it's a Quintessence Publishing body, and they tell you how did they perform it, and these are with images added. Okay, it's beautiful. It gives you classifications. It gives you things that you need to know or be very accurate when you use the terminology. Okay. So see how beautifully illustrated and how it's here. I'm going to download this and just send it to you, to your group on Telegram. I will send it to you on your group on Telegram. I would like to see the ITI one with this side by side so I could give you more insight on the differences between them. Okay. So this was our quick presentation on the skills of using terminology, scientific terminology, clinical terminology in our specialty and in research wise. Okay. Any question, please, if you have any regarding these subjects, please feel free to ask. It seems very clear.
Yes.
Okay. Clear. As I told you once more, just to sum up, if you are working with research, you go to the MESH, the medical subject headings, and write down your topic of your research or the keywords in your research in the title, and then search each word of these and try to find the terminology related to it. So this is my requirement from my thesis, my students that I work with thesis, okay? This one is for you as a prosthodontist. You should know each bit and piece of these terms because they are totally related to your subject, to your specialty. And by the way, orthodontics have a glossary, oral medicine have a glossary, periodontics have a glossary. So you'll find multiple glossaries around. This is the one for prosthodontics. This is published in the Journal of Prosthetic Dentistry. This is the ADA, the general ADA if you're working in America. These are the procedures that you should know. These are the administrative terms you need to know. This is when you open a clinic and you begin with these administrative tasks other than your regular dental tasks. And this is the one illustrated, and this is related to implants, this one and the one with the ITI. Just a final say about this one. I wish that I had proposed a project. If you are interested, you, my students, or those that are watching to YouTube, where I wish that I could put this each term on its own in an electronic format where if you want a term, you can find the definition. You can find, if you press on something called synonyms, you'll find other synonyms. You can also find different reference for this, images, multiple images, maybe animations. I wish to do such an application on mobiles. So turn this for our specialty into something more interactive, where you can pick and choose what you want out of this terminology. If you want an animation, if you want an image, you want a video showing the procedure, an image showing the parts of a tool, or so and so on. I'm happy to collaborate with such a big project, and we can put it on as a mobile application. Okay, this is our presentation for today, and thank you very much.